In the meantime, ultra-processed foods aren't just putting your waistline at risk. A new study finds people who eat over 2 pounds of ultra-processed foods a day increase their risk for dementia by 58%. The study also found that people can face a 46% increase in the risk of cognitive decline. Dr. Eboni Cornish is an associated medical director of the Amen Clinic and joins me now. Dr. Cornish, thank you so much for joining us. So when you hear this, you think 2 pounds of ultra-processed food a day is a lot. So how concerned should we all be about this?
Yes, coming from family history, my mother and my grandmother both had dementia, so this is very important. What we know is that as our visceral fat increases, our brain shrinks, and the area of the brain that shrinks is responsible for memory. As our sugars go up, which we need to be really aware of now, we know we have increased risk of diabetes and pre-diabetes. We are now calling Alzheimer's type 3 diabetes. So all it takes is one good step at a time. Now, women have 2/3 the risk factors for Alzheimer's and dementia. So moms, it's time to think about making those healthy breakfasts this morning, because as we increase inflammation by not taking care of our gut, our brain function decreases. So I always tell my patients, make it one step at a time. It doesn't mean that you need to think of it as expensive, but you need to make sure you're putting one less toxic food and one positive whole food a day. If that means an egg, if that means avocado, if that means an omega-3 rich food every single day. If you can afford the processed foods that are there, you gotta think of the cheaper alternatives that are realistic, like the frozen vegetables, like the canned foods, like those things that can serve you and your family and your brain better.
Yeah.
What I find, a lot of people think that you need to start thinking about brain health later in life. And that's one thing we do at Amen Clinics, is that we look at brain imaging because we know that there are changes that can occur in the brain way before symptoms of Alzheimer's and dementia present. So loving that gut of yours is loving that brain, because none of us want shrinkage.
Dr. Cornish, it's all connected.
Better
Absolutely,
brain.
yeah.
It's all connected.
In the about a minute that we have left, I do want to get to this because it's important and hopeful. There's a new pill that's making waves in the medical community after a clinical trial showed it doubled the survival rate for one of the world's deadliest cancers. It's called daraxonrasib, and a person taking it, the median lived a median of 13.2 months compared to 6.7 months for chemotherapy. What can you tell us about this drug?
Yes, it's a blessing. And what it does, it helps with pancreatic cancer, which we think is one of the most deadliest cancers available without many treatment options. It works on RAS, which is like the gas pedal that keeps those cancer cells replicating. So this provides hope. Even though it's not available now, it will be soon, and it provides so much hope from those people who are struggling with pancreatic cancer. And we are very excited about it.
This is the drug that former Senator Ben Sasse is taking, and he says that it's decreased his pain and decreased his tumor size by 76%. So certainly very hopeful here. Dr. Cornish, thank you so much for joining us this morning.
And thank you for having me this morning.
Be sure to like and subscribe for all the Fox News latest on YouTube, and catch full shows streaming now on Fox One.